Good There we go. Good afternoon, everybody, and welcome to the training webinar on the Uniform Data System, or UDS, reporting for 2025. Thank you for taking the time to join us today, and we hope that everyone's doing well. My name is Sawyer Lubold, and I'm going to be your facilitator for the day. Joining me, I have Rashmi Naveen, who is going to be conducting our demos, and also a few project team members on the back end that are going to help us with the Q&A. We're going to take some time today to go through the different features in UDS and give you some helpful tips and tricks so that you're comfortable with the system. Before we get started, just a few administrative items. Unfortunately, all of your mics will be muted, but if you have any questions throughout, please go ahead and enter them into the Q&A pod, and we'll be answering questions throughout the presentation and at the end of the session if we have time. Anything that we don't get to, we will follow up on later. We also have a few questions throughout the sessions to try to make it a little bit more interactive and just to make sure that we're doing our jobs well. And note that you can download the slides in the chat box, and the recordings and the slides will once again be sent out to the HRSA website in the next week or two. And last, but hopefully not the most important, please bear with us if we are having any technical issues, since we are hosting this from different places and using test environments. And with that, I will hand it over to Alicia Darden from HRSA for her opening remarks.
Thank you, Sawyer. Good afternoon, everyone. My name is Alicia Darden. I'm a management analyst on the data production team here in HRSA's Bureau of Primary Healthcare, Office of Quality Improvement, and Data and Evaluation Division. We're excited to introduce you to the UDS preliminary reporting environment, also known as the PRE. The PRE is a valuable tool designed to help health centers get a head start on the UDS reporting process by allowing you to begin entering and validating aggregate level UDS data before the reporting period begins on January 1st, 2026. Using the PRE can provide a smoother reporting experience as it is intended to help identify and address potential data reporting issues early. So far, we've seen that a few health centers have already accessed the PRE and encourage more of you to take advantage of this environment to ensure a more efficient and accurate final UDS submission. We know that there have been some issues with accessing the PRE. Please note that those issues have been resolved and that all health centers should be able to access and begin entering their data into the preliminary reporting environment. We hope you find great value in the presentation and materials we share today. I would also like to take the time to remind everyone that UDS resources are located on BIPIC's UDS Training and Technical Assistance webpage. These resources provide additional guidance on UDS reporting to a complete, accurate, and timely submission of the 2025 UDS report due to HRSA on February 15th, 2026. We encourage you to add your questions in the Q&A pod. If your question is not answered during the webinar, feel free to reach out to the team through the BIPIC contact form. We value your feedback and invite you to complete the post-webinar survey, as it will help us streamline and improve our technical assistance resources. And just as a reminder, this webinar will be recorded and published after post-production finalization is complete. And we thank you for your time today and look forward to providing additional guidance on your understanding of the preliminary reporting environment. I'll pass the mic back over to Sawyer, one of our training specialists for today's session. Next slide. Thanks.
Thank you.
Right. I'm also going to kill my video so that way you guys don't have to watch me the entire time. Bear with me.
I'll do the same. Just give me two. Yeah. No, go ahead.
So as you can see, we do have a packed agenda today, starting out by looking at the objectives for the session. Then we'll take a look at how to get to the UDS reports and how to navigate through the system and the status overview page and tables. We'll talk about the preliminary reporting environment, or the PRE, and how to compare data between reports. Next, we'll look at the offline Excel and offline HTML features, as well as how to clear data and run the data audit report, or the DAR. Last, we'll discuss how to review, submit, and download your reports. And then we'll talk about help resources available to you and hopefully have time to answer your questions at the end. Throughout the session, we will have live demos. That way you can see what everything looks like in real time. By the end of the session, you should be able to access and navigate through the UDS reporting pages and the different features. You should also have an understanding of the offline Excel and HTML data entry options and how they can help make your reporting process easier. We also want you to know the steps to take to review and, most importantly, submit your UDS reports. Before we get started, for your reference, here's a quick list of the acronyms that we're going to be using throughout today's presentation. The slides have been included in the chat, so you can reference this acronym cheat sheet at any time. And with that, let's go ahead and get started for today's session. First, we're going to take a look at how to navigate through UDS. As we look at screenshots in the system demo, we want to point out that none of this is live data. Everything is fake and used for testing and demo purposes only. To get started with your UDS report, go to your task page in the EHV and then find Performance Report Task. On the far right side of the row, click Start or Edit if you have already started the reports under the Options column. This will open the status overview page. At the top of the page contains a banner to clearly show if you are in the live UDS reporting environment, the preliminary reporting environment, or offline HTML version, since these all look alike. The left menu provides quick links to downloading, uploading, or clearing data, as well as opening tables. The middle of the page provides the due date information and a countdown to that date so you know when your report is due. And the far right side has the Forms Overview widget with a status tracker so you can quickly see how many forms or tables are complete, in progress, or not started. At the bottom of the page are a variety of resources for you to access as you use the system. At the bottom of the page, you can see each report or table listed, as well as the status and when they were last updated. You can also click the link for each one to open. On the left menu, you can click to review the report, and once everything is completed, submit the report. On the right side of the page, you have several widgets to make it easier to use the offline Excel tool. You can select a download a custom template with only specific tables, which can be Excel or HTML, or download an Excel file that is a blank template with no data included. Select download a template with data if you want to download an Excel file that includes existing data already entered into the system. And once you're ready to upload the offline Excel file, click Upload a File. Additional widgets on the status overview page allow you to easily compare versions from previous years or previous versions of the existing report that have been submitted using the Compare Versions widget. You can also view the BICMIS ID and when the report was last submitted using the report's details widget. And finally, you can click to submit, compare versions, or print the report to keep a copy using the Submit and Print widget. And now I'll hand it over to Rashmi for our first demo of the UDS navigation.
Thank you, Sawyer, and hello again, everyone. Before we get into the system, I wanted to remind everyone that any data that you will see within the system demo is only test data. It's not real. Let me get to the login page. What you're seeing on the screen is the login page, and I'm going in or logging in as a Health Center HAD user, so I can access my performance report. I've entered in my username, I have my password, and I'm selecting the login button. This navigates us to the EHB's homepage. Apologies for that little lag, but this is the homepage, and I'm going to the task tab right on top of the navigation bar, selecting the task tab. This will navigate us to the pending task list page. And I'm able to see all of my reports in this output grid. Now, visually, I can quickly spot my performance report here. But if I was not able to spot my report because we have a lot many tasks in the list, a quick way would be to filter it out with a tracking number. But if we want a generic way to filter out performance report, I can just include the word performance or performance report, select the filter icon, select contains, and this will quickly filter out my performance report. Remember, this is a testing environment and I have a 2024 report in here, but that's actually not correct. When you go into your environment, we have it for testing purposes, but when you go into your systems, you will see only the 2025 version of the performance report. Now I'm coming to the last column, the options column, and I'm selecting this edit button. This will show a start if I'm accessing my report for the first time. So obviously I've come into my report many times, so I have this edit button. This will navigate us to the status overview page. Now, let me pull this up a little bit. Before we jump in, I want to remind everyone that this group, again, has varied levels of understanding of the UDS system. The knowledge levels here can range from health centers and representatives who are brand new to the system, all the way to veterans who are here just to jog their memory and to check out the new changes for the year. I'm calling attention to this because we will be walking the whole group through some very basic aspects to the newest updates, hoping that you'll go back with a better understanding of our system. So please bear with us. Keep that in mind as we go through this presentation. Okay, back to the system. This is the status overview page. And as you can see, there's a lot of information included in this landing page. The purpose of including all of this information is to give you quick access to all the frequently used actions. We'll walk through and get a quick overview of some of the most important features on this page. The very top, as Sawyer had mentioned, we're viewing this banner that indicates the environment that we are working on. What you're seeing on my screen, obviously, is the UDS reporting environment. This will be available to you at your end only after Jan 1st when reporting and submissions open up. Remember, I'm using a test environment, and so it's slightly adjusted and our code and functionality is backdated. Currently, if you go into EHBs, you log into EHBs UDS, what you will see is that you'll be able to access your report in the PRE, the preliminary reporting environment. That'll be indicated with a yellow banner. Let me pull up a screenshot so you have a visual of this. And let me zoom in just a little bit. So this is the same page with very, very similar functionalities. The only thing that you will not have at this point, as we go through this presentation, is you will not have access to the submit button, because the submit button will be available to you after January 1st. So that'll be the only thing that's not available to you. Everything else will be available to you as we go through the system. Whatever we have right now will be available to you even in the PRE. But this is how you will see the banner at your end. It will clearly call out that you are in the preliminary reporting environment and that you can validate, you can enter your data, you can validate your data, but you will be able to submit your report only starting January 1st. Okay. So that's a good way to identify the environment you're in. We'll also come back to this identifying the environment with the banner when we get to the HTML page or the HTML file. Okay, back to our system. Okay, below this, in the middle, right after the note, below your health center's name, you'll see the date and time for when your report is due and a countdown for the number of days left to submit your report. Now, underneath that, we have a resource section. Again, it has various links to very helpful materials. Let me walk you through some of them. The first one, this is the UDS manual. This will give us access to the latest UDS manual for 2025. So you will have access to the 2025 manual here. Let me close this. The next one is the UDS training and technical assistance. Now this will navigate us to BEPIC reporting and guidance, a page where we have access to like various training material, helpful information, helpline info, and various other useful information and resources. The other would be the training materials link. Here you have access to all the UDS acronyms that are used within the system, some user guides, and also frequently asked information. Again, very helpful in terms of filling your data and submitting your data. Below that, we have access, and I'm coming to this UDS report status section right in the middle. We have access to or access links to contact information and all the tables and forms that that will include the status of each of these forms and the last updated information. So this is a good quick way to get into each of your forms as well. Below that, we also have report comments and data audit report. Now, before we move to the rest of the page, I want to highlight some of the funding stream related updates for this year. The funding stream names have been updated throughout the UDS system. And again, this is an overarching update. Let's start with, and I'm taking an example right here from table 3A. Universal report remains universal. The homeless population used to be healthcare for the homeless, acronym HCH, but it's been updated to homeless population. The second one, this migratory and seasonal agriculture worker, this is the new label. It used to be Migratory Health Center, acronym MHC. And we used to have PHPC, Public Housing Primary Care, and that's been updated to Residents of Primary Housing Report. Now, these updates are applicable only for the H80 program. We can view these changes based on the funding stream specifically applicable for our own reporting requirements. Some of us may be reporting only for universal, so you will not see the rest of the funding streams. Or we may have a combination of universal and homeless population. But here, obviously, I have a H80 program with all the 4 funding streams to, to show you all the changes. So you will see this change depending very specifically to your reporting requirements. Okay, from here, let's move to the left side of the page. Right on top, we have access to the download file page, upload file page, and then clear data functionality. We'll come back to this and we'll talk more in detail as we go through the webinar. Below this, again, we have links to the contact information page and all the tables. We also have links to the report comments as we want to include report comments that'll go to HRSA. Once we've completed tables, we can come into the DAR, the data audit report page, run the DAR, clear all of our edits in the DAR, and then review all the data that we have entered. And eventually, when everything looks good, we can submit via the submit link or submit page that you can access through the submit link. Okay, that's the left side of the page. Let's go to the right side of the page. The first section here shows us a quick snapshot of our table status. And it also gives us the last updated form that we were working on and date and time. Below this, we have the offline Excel tools section. Now, this section includes 4 different links that perform 4 different actions. These are part of a tool set that we can access from the left menu. We just looked at that, and we'll go into detail as the webinar progresses. But this has been brought forward for awareness because these are very helpful tools and give you easy access through here. The first link, the download a custom template, will navigate us to the download file page, and we can make custom choices in there and then download the file. The last one, and I'm going to the upload a file link. Now this will navigate us again to the upload file page where we can, sorry, this is the upload file page where we can upload all of our information back into the EHPs. I'm just showing you the links here, but we'll go into these functionalities as we move through the webinar. And then we have these two other links, the download a blank template and download a template with data. Now, these reduce the number of steps involved, and they'll download the file with this specific condition. So if I click on download a blank template, it will simply download the entire file with all the tables, and it will give me a blank template without any data, even if there is existing data in the system. And download a template with data will give me an offline file, an Excel file, with all the data that's already included in the system. But it saves us a couple of navigation clicks, and you can do it right from this landing page. Okay. Below that, we have the, let me pull up this page. Below that, we have this compare version. Again, this is not a new tool, and this has been brought forward because it has been quite heavily used. And now we can choose the reference year from the drop down in here and the compare year from the drop down in here, and select next to then use the compare version tool itself. Again, this will save us a couple of navigation pages and clicks. And you can go through, you can utilize this tool right from this landing page. Below that, we have the report details section. And this just shows us some details related to our reports. And this might come in handy for reference purposes. The last section here is submit and print. Again, these are frequently used actions. We can submit our performance report once we've completed everything through the left and the right side of the page. We again have access to compare versions, and we have access to the print option feature. With that, I hope you are a little more familiar with this first landing page, and I'll give it back to Sawyer.
Beautiful. Thank you, Rashmi. And just as a reminder to everyone, if you do have any questions throughout this presentation, please go ahead and drop them in the Q&A pod, and we will make sure to address those. Now, let's go ahead and talk about the preliminary reporting environment, or the PRE, and comparing report versions. The preliminary reporting period, or the PRE, is an optional feature that allows you to go into the system prior to January 1st, which is actually available now, to get used to the system, see what data is needed, including new fields, and begin entering data if you would like. Hopefully, this extra time will give you a chance to get familiar with the system and improve the quality of the data entered, since there is additional time to work on the entries. As mentioned, during this time, you will see a banner at the top of the pages indicating that you are in the PRE. And please note that you are not able to submit the report during this time, meaning you cannot submit before January 1st. And during the demo, Rashmi will show you what some of these changes in forms look like live in the system. You now have two ways to access the Compare Versions feature. First, from the Resources section, or the Compare Versions widget. When you open the Compare Versions feature, you'll first select the year and version from the drop-down menus and select Next. Note, if you use the widget on the Status Overview page, you will skip the Select Versions page. Next, you'll see a list of tables to select from. You can select all tables or only specific tables you want to compare. The Change Status column will show if information differs from the table. After making your selections, click Compare. Once on the results page, you will see all fields for the selected tables, and you can easily identify fields with different information because they are highlighted and have a dot next to the numbers. And with that, let's take a look at the PRE and compare versions feature for our second live demo.
Thank you, Sawyer. And we are back into the system. Like Sawyer mentioned, this preliminary reporting environment is currently available to us for preparing and validating our data while reminding us that we will not be able to submit our report till Jan 1st. Now, this period of system availability gives us extra time to familiarize ourselves with the changes and reporting requirements for 2025. Let's go over a couple of tables to get an idea of what we can expect to see for 2025. I'll give you the similarities and then we'll also look at some of the changes. Let's go to table 3B because I can give you the similarities and start with showing you some of the changes. Now, if this is not your first year reporting data in the UDS system, then you would be very familiar with the general layout of this page or form. The look and feel of the tables and forms have not changed from the previous year. The basic navigation, and I just show you the navigation from the status overview page and the left menu, they are all the same. Navigation between the tabs will also remain the same. The way data is generally validated remains the same. Let me take you to, let's start with this. So I'm going to enter incorrect data, and you will see that once I have incorrect data, the system will fire edits that I will now need to go in and correct. So that way I can sanitize my data and correct my data. And we have over 8,100 edits of this kind throughout the forms and throughout the tables to help us navigate through entering in good quality data. And remember, each year at the back end, all of these various edits, and if we enter, let me go to one of the funding streams. And if I'm entering not negative numbers, but if I'm entering incorrect data, it will also give me edits. So we have variety of edits thrown around on almost every field that will help us provide good quality data. Going to the, okay, let's go to the bottom. So that way you know that we can now clear those edits and then eventually complete the tables. Going back to the universal tab because I want to show you going down to the page. We have the comment section. We continue to include the comments or edit comments. We can also come back to the bottom of the page. Once we have data included, I can choose to continue saving my page with the save button. And once I save my data, I will either have edits to clear out or or it'll give me a success message. Let me wait for it just to show you the success message. And this is going to be across the system. Anytime I'm saving, anytime we are including new data, one, it will give us warning. Second, it will give us a success or failure message to give us a confirmation. Again, apologies for a little bit of a lag there we have. So this is the kind of success message we will see throughout the system when our operation or action has been successful. Going down to the same page, similarly, if I want to just save my data and continue to the next form, I can then choose to select save and continue. So and I'm going back up, while a lot of this functionality remains the same, the UDS system has been updated to align with the 2025 UDS manual. Let's review the most impactful changes within the system at a very high level. Just in interest of time, I'm going to skip very small changes or label changes because there are quite a lot of label changes throughout all the tables. We recommend that you refer to the UDS manual, the 2025 UDS manual, for a comprehensive list of all the changes. But I want to take you through some of the most impactful and high-level changes. Okay, let's start with the header information. I'm going right to the top of the page and I'm expanding on the header section. And this is where we will find information about our health center. And we'll see you also have information related to the funding streams. And those acronyms have been updated, just like I had mentioned in the status overview page. So we will see this sort of change in almost every single page. And anywhere we see acronyms, they will be updated. Anywhere we see the long form labels, those will also be updated. Moving down to the page, again, the acronyms for the funding streams within the tabs have also been updated. And remember, I am seeing all the four funding stream tabs or funding stream acronyms here because I have used a HAT and a 4 funding stream combination report, just so I can show you all the changes. Continuing further down, and this is table 3B, you'll see that we only have lines up to line 12, and we don't have the entire section for patient bisexual orientation gender identity. That has been completely removed, and we no longer are required to report for those metrics for this year. So that's table 3B. Let's go to table 4. On table 4, I'm going down to line 14, 15, and 16. Now, these are language or label updates, but they do align very closely with the funding stream updates. And so I wanted to highlight this for everyone. I'm going down to the bottom of the page to line 26. We now have a new footnote included. And this is some good guidance that has been provided here, but this will impact all the rest of the footnotes that were previously included in the system. So if you have them mapped out internally in your internal system and processes, that adjustment will need to be made at your end. And that obviously goes for almost all the changes within the system. Okay, that's table 4. Coming to table 5. We have a couple of important updates here, and I'm going, again, a reminder, I'm not going through label changes. I'm going to show you just high-level impactful updates. So we've included some options for line 22 and for line 29A. Going back to line 22, so I can give you some details on here. So line 22, other professional services. This now includes multiple options of services that we can choose from. The values that we enter or the data that we enter continues to remain the same. But we used to include free text to describe these services, and now we have options that we can choose from. So as a user, I can go in and choose all my options. But if I see that there is an option that is not listed in here, then I can go to the last option, the other professional services, specify not listed. So if there is a service that is not listed in here, then I can utilize this text box to describe the service. But remember that we can now choose, and if we don't see that service listed is when we include it in this text box. So that's line 22. Coming down to line 29A. Similarly, this line also now includes multiple options for programs and services. The data entry remains the same, but now we can, instead of describing everything in the text box, we can choose from the various options provided to us. And if we don't see the programs and services listed in here, we can come into the last option, the other program and services specify, not listed. Again, this refers to anything that's not listed in here, and describe the program and services. So that's another change for us in terms of how we want to enter in the data and make our choices for table 5. Now coming to table 6A. And as table 6A renders, again, a reminder that, I have set up all of this data just for our demo purpose, but when you're going through, you will be entering new data and you will see a lot of edits fire, and you'll go through each and every table as you fill up the data. Okay. For this table especially, I want to make sure that I'm not going through all the code changes, because almost every single line has a code change. There are also lot of label changes, but I'm going to take you through the new service categories that have been included. I'm going to the bottom, or scrolling down to the page, and after line 26C, we have this new service category that's been included, 26C2, tobacco use cessation pharmacotherapies. We now have to, we are not now required to report number of visits and number of patients for this category. Same way, we have a new line, 26C3, medications for opioid use disorder. And we are required to provide data for patients and for services. Visits and patients. Similarly, we have a new line 26F, Alzheimer's disease and related dementia screening. And we are required to provide data for the number of visits and number of patients for this category as well. So these are 3 new lines and 6 new fields for which we are required to provide brand new data and the brand new data requirements for the year. Going to table 6B, we do have a new section in table 6B, new quality of care measure. And I'm going down towards the bottom of the page. We have this new section N, substance use disorder measure. So we have 2 new measures related to that, 23A and 23B. And this year we are required to provide data for total patients aged 13 and older diagnosed with new SUD episodes, number of records reviewed, number of patients who received SUD treatment. So this is a brand new set of data requirements for 2025. Going to table 7, it's not a brand new data requirement in here, but I know generally table 6B and table 7 are important. I just want to go over some of the label changes here as well. Right on top, and this may be something that you map at your end, table 7 used to be called, the title used to be Healthcare Outcomes and Disparities, and now it's just Health Outcomes. I'm coming to line 0, HIV positive pregnant women. This word women used to be patients. It's now been updated. I'm also going to the last diabetes related section, section C. We see that the language around it has been updated to glycemic status assessment greater than 9%. And on the same section, the last column has been updated to align with it, column 3F. Okay, that's table 7. Table 8A does not have any new reporting requirements. You will be reporting on the same set of data points from last year. Table 9D does not include a new data point, and I'm coming to line 9 here. We do have an opportunity to include or describe anything that we want to related to line 9. So anything that we want to convey to reviewers can be included in here. Then going to table 9E. we do have a lot of label changes, but other than that, line 1L, 1M, 1N, 1P, and 3B, they have all been removed for the year. So we will no longer be reporting data for these data points. And aligning to that, you'll see that all the totals have been updated in terms of the calculation, so it aligns with the fields that are being calculated, and also at the back end, because I know that these are auto calculate fields. At the back end, these have been adjusted to align with the data points that will be calculated for each of these fields. Okay. And that's 9E, going to table HIT. In HIT, and this is true for all the three tables, the dynamic tables, HIT, ODE, or other data elements, and workforce, there are a whole bunch of label changes. And again, a reminder that I'm not going into them, into those label changes, but let me highlight a few helpful information that's been included. This is the notes right above all of our questions. And this is some helpful guidance that's been included related to question 12 in here. This is brand new for this year. For question 1, I'm selecting yes because I want to get to question 4. So for this year, some validations have been included for most of these questions that have a list of responses for us to choose from. So that would be question 4, question 5, question 10, question 12B, 12A, sorry, 12A, not 12B, and I'll come to 12B. But let's take an example of question 4. I can, the question is, which of the following key providers in healthcare setting does your health center electronically exchange clinical or patient information with? So I can choose the key providers in healthcare settings, and I can choose almost all options. Now, if I also come in and choose the negation of these, the no, none of the above, so the no option, I will see that there is this validation message that pops up, and it'll clearly tell me to unselect all the above options since you've chosen or selected none of the above. So I can come in and I can either unselect the none of the above if I have chosen that by mistake, or if my response is none of the above, then I will need to remove the rest of the options that I may have selected, because they both are negation to each other, and only one of them can be selected. Now, if I have them selected, if I have both these selectors, my information will not get saved, even if I save if I click the save button, because this is a critical validation. Until I don't follow these rules, one and unselect one of these negated options, I will not be able to save my data. So for this, I'm going to unselect the other options and I'm going to go with none of the above. Question 5 is very similar. I can select I can select how I engage patients through health IT services. And I might be selecting all of this, but then I come down and I select the no option. No, we do not engage patients using health IT. So if I select this, then naturally this is a negation. And so I will have to unselect one of the options. And maybe I have selected no, I do not engage by mistake, and I can now clear that validation. This is true for question 10. Similarly, I can once I select both, I will see this validation message. I will need to unselect one of these options and then it'll go away. Similarly, and let me get to the yes response to question 11, and I get to 11A. I'm going to select something here. So I get to question 12. It's the same case for question 12. I can select from these options, but if I also select no, we do not use standardized screeners, because I'm obviously providing the standardized screeners that I do use, then I will have to unselect one of these set of options. So I may not be using standardized screeners, so I may need to unselect those options. The only place where this validation is not included is question 12b, because all the options are responses that users can select. They are not negations. Okay. So, okay, I do have a critical error and it will not save. Anyway, I'll come back to this. But I just wanted to show you the validations that are included for this year. These are brand new validations for the year. Table ODE, we don't have new data sets that are included, but there are label changes. So make sure that you refer to the UDS manual for that. Let's get to workforce. Again, in workforce, I think, and I'm going, the first question, I'm responding yes to it so that we can look at question 1A. And if you remember, we have included a footnote in table 4, due to which all the other footnotes, and some of them were actually in HIT, they have been renumbered. And similarly is the case in workforce. You'll see these have been renumbered. So this used to be 3 and 4. They are now 4 and 5. This footnote used to be 5 and now it's 6. I'm going down to the bottom of the page, and you'll see the same way all the footnotes have been renumbered. We also have a brand new footnote, so new guidance on question 3, and that footnote has been included at the end of all the footnotes. Okay, so I think these are the high-level changes within the editable forms. Again, as we move through the presentation and we look through all the other tools, the downloaded files, etc., we'll see the same changes being implemented and flowing down to all of those documents. I wanted to go through most of the changes here. We may touch upon some of those changes in those documents, but be assured that all the changes that you're seeing here will also flow through all of those tools. And as a reminder, again, these are only high-level updates. For a comprehensive list, we'll need to refer to the 2025 UDS manual. Okay. Now, to aid us in this process of data reporting, we can leverage the compare version tool. And this is what Sawyer was mentioning. I'm going to go to the resource section. And if you remember, when we were on the status overview page, we did look at the compare version tool access there. But if you're on any other page or any other table, we will see the resource section, and the compare version link is the last link under this resource section. So because we are right here, I'm going to go through the last link. This is the compare version link. Selecting compare version link here. I can now select the reference here, and I'm going to select 2025 version 1. This is the report that I'm currently working on. For compare year, I'm selecting last year's version 5. This was the last report that I had submitted for 2025. 2024. And remember, I can compare any two documents. Like I could also go to 2024 version 1 or 2020 version 2. Any reports that I may have submitted to HRSA are going to be available to me. So for our example, I'm going to compare the 2 years because I can show you some examples. Going to the next button, selecting the next button. This will navigate us. Let me expand the page. It navigates us to the select table page. And again, I want to quickly show you this header. And remember, we were looking at changes to the funding stream. Now this is going to be the same change across all the headers on all the pages. So that's one of the changes that's trickling down. Going to the first column, you'll see that we all the tables and all the forms have been listed here. And as we are here and as we've come to the first tool is the compare version tool, all the funding stream acronyms have been updated in here too. So it'll be updated in all the forms that we see within the compare version as well. And we'll see this included for every single table. And remember, I'm using a H80 program for funding stream combination. That's why I'm seeing every single funding stream listed out here. The second column is selected by default. So all the tables are selected by default, so we can go and compare, but I can unselect all the tables by choosing the unselect button. And I can then select only the tables that I want to go and compare. For our example, I'm going to select table 6A and 6B because I can show you some of the changes. And the last column is change status. Now, you are seeing each of these table being changed, and it calls out change because I'm comparing two separate years. So naturally, every single data point has been updated. But for example, if I was comparing two different versions of the same year, I may not have every single data point changed. And so I may have only few data points that have changed, and only those data points or those tables will be called out as changed. So it'll be easier for you to spot where the changes happen. All right. With my selections made, I'm going down to the bottom of the page, the right side of my page, and I'm selecting compare. I'm selecting compare button. This is going to take me to the compare version result page. Again, right on top, there's this helpful note and some information on how you can use this tool. Below that, and because we're starting from 6A, remember we chose only few tables. So it's starting with those tables that I had chosen. The general format of this tool is very similar to the editable forms or editable tables. We see the sections being called out or named very similar to the editable forms. So that way you can identify which section we are looking at and the data that we're comparing to. We also have, if you look at just general layout, we have the line numbers, we have the field names, we also have the columns, and the columns that now include data for both the reference year and the compare year, side by side. And the compare year version report data is included within the parentheses. And if there's a change, obviously we have changed to every single data point. But if there is a change, you will see it highlighted in yellow with this little blue dot. Some of the benefits of using this tool are that we can clearly see, and let me go down to the brand new lines. We can clearly see the lines or data points that were not available till last year, because remember, we are comparing it to the last year's table or last year's report. And I'm coming down to this new line 26C2, and this has been included for 2025. And this is going to be the case of 26C2, C3, and 26F. So anywhere we have new data points, I'm coming to this data point column, we'll see that I have entered new data for this data field, but I did not have this available last year, and it's going to clearly say NA. So this is a good way to identify if there are any fields that were not available last year. The second or another huge benefit is that we can compare data side by side, and we can quickly catch very large discrepancies. Let me take you to, let's say, line 26. If we can visually see this side by side, and you can see that 50 and this large number is quite different from each other, a very large discrepancy. And remember, everybody, this is just test data. So we've included this data to show you the discrepancy in this large number. But the minute we can visually see this sort of discrepancy, we can go in and do a double check. Maybe we have a wrong data set, we've made a mistake in entering the data, or maybe the data is correct. So if we have, obviously we've been mistaken in how or the the data quality, then we can go in and adjust those numbers, and we can then we can provide good quality data before we send this data out to BIPIC, to HRSA. But the alternative could be that this is correct data. And if we see that there is such a large discrepancy, this gives us an opportunity to provide some color to it. We can add some comments. This is in 6A, so I can go to the 6A table and add some comments that'll go to the reviewers and add some color to the reasoning behind such large discrepancies. This will just avoid a lot of back and forth, and you've provided some explanation for some of these discrepancies. So you can sanitize your data with this tool even before you send it out. And it can be between the 2 years, multiple years, or it can be between different versions, especially when you get a change request, the change request from the reviewers. So again, we highly recommend that you leverage this tool to your advantage. And with that, I'll give it back to Sawyer.
Thank you, Rashmi. And this leads us into our first quiz question. What does the preliminary reporting environment, or the PRE, allow users to do? Go ahead and take a moment and think about your answer. All right, the question, what does the preliminary reporting environment PRE allow users to do? If you answered C, enter data in the report prior to January 1st, you were absolutely correct. Good job. And just as a reminder, if you have any questions that you would like to ask, please, during the presentation, go ahead and take a moment and put them in the Q&A pod. And just another quick reminder that the slides and recording of this session will be available to you in the next week or so after we get everything finalized. Now we're going to go ahead and jump in and take a look at the offline Excel capability for data entry. Let's take a high-level look at the offline Excel process and then dive deeper into each step in the coming slides. First, you'll need to download the offline Excel file, which will have each table you selected on a separate tab. Then, enter your data or use the Excel mapping document to transport data from your current Excel files. After entering all of the information, upload the file back into UDS so the data is processed and populated on the forms. And finally, once uploaded, you will see an edit summary file so you can determine if there's any data that needs revisions before you submit. When downloading the Excel file, you have several options. You can select a file with data currently in the system or a blank file with no data, on which you'll need to enter the data from scratch. You can also download the whole report or just specific tables you want to work on. From the download file page, make your selections. First, select offline Excel. Next, select Excel with data or blank Excel. Third, select tables or the entire report to download. Next, if you selected patients by zip code, you have the option to include the zip codes from the previous year. You will only see this option if patients by zip code is selected, and we'll talk more about that in just a moment. And last, after making all of your selections, click Download. So just a bit more about the table for patients by zip code. When downloading the Excel template with data, you can choose to include zip codes from the previous year on the table. This feature is only available when downloading the table patients by zip code, or the PBZC, which is a mouthful to say if you're curious. And this provides an easy data entry for this table and saves time in search for zip codes. Most important, when using the offline Excel file, do not add, delete, or edit the spreadsheet columns or rows. and make sure you are using the 2025 versions so the information comes through correctly into the system when you upload. Because, as Reshmi just showed us, there are differences each year. Once you download the Excel file, you will see all the tables you selected listed at the bottom of the page. Reshmi, last slide, please. You will see the tables you selected at the bottom of the page of the Excel file as separate tabs so you can select which one you'd like to work on. At the top of the page, you can see the unique file name and version. This is generated when you download the file, but you can change the file name to make it easier for you to find. It's also important to note that line 1 of the Excel file also provides notes about what kind of data should be entered for the table you are on. A bit of an overview, be sure to upload the file. The EHBs will verify the file format and tabs and structures before accepting this file. The EHBs will assign you a unique file name on upload. On successful uploads, the UDS forms will be populated with the data from the file. If you upload a blank Excel template, it will clear all data that was previously entered. And finally, upon upload, you will see a listing of the tables that were uploaded as part of the success message. To upload your Excel file, click Upload File from the left menu or from the Offline Excel Tool widget. Then, on the Upload File page, select Choose File. Once you've selected the file, click Process File, which will upload it into the system. You will then see the success message listing the tables that were uploaded. At the bottom of the page, you can see if there were any edits that failed, meaning you will need to take another look at the error file in the download column to see what fields have errors and make your corrections. Note that if there are no errors, you will see a 0. If there are errors, you will see the number and can open the file to see which fields need your attention. To view any files that have been uploaded, including the error files, go to the Upload History page, which you can find in the Resources section. And before we move into the next demo, just a few helpful tips about the offline Excel feature. First, you can download and upload a file as many times as you need while working on this report. After uploading the file, the system-generated name will always have the same version number as the error file, so you can easily tie those together. And each time you upload the file, the version number will be increased by 1. So if you upload the file name 1, next time you upload it, it will change to file name 2, etc., etc. And with that, I'll hand it back over to Reshmi for our third demo, which outlines the offline Excel features.
Thank you, Sawyer. Let me pull up the system back again. Okay. Now to download the offline file or to work with any offline file, and because we are on this workforce page, I'm going to the left menu. And remember, we could also access the download file page via the status overview page. But for now, I'm going to the left side of the menu and I am selecting the download file link. This will take me to the download file page. Again, there's a header, and remember, we have resources on every single page. There are some very helpful instructions and how you can utilize the offline tools. Below this, we have the download template. Here I can choose from 2 separate formats, the pre-selected offline Excel or the offline HTML. For now, we'll go with the offline Excel. We'll come back to the offline HTML and look at it in detail. Below that, we can choose from the data level. I can now choose to download this Excel file with the data that's already existing in the system, or I can choose to download a completely blank Excel file. That means that it's not going to give me any data that's already in the system. It's a great way to start fresh. For example, if I've been playing with the system, I've included a lot of data, but it's not good data. I may want to just download a blank Excel file and start entering in new correct data and then eventually plug it back in. But just remember that anytime we plug in we plug in the information back again, or we upload a file, all of that information is going to be replaced. All this information within the system will be replaced with the new data set. So if we have any blank cells, blank tables, they will all be replacing the existing data which is already in the system. So just be a little careful with this, but it's a great way to start fresh. For now, let's go with the Excel with data. Then I have a choice of tables to select from. All the tables are pre-selected because it's generally when we download, this is like a package. So we can either go with all the tables and work on all the tables, but we can also unselect the tables and work on individual tables or very specific tables as we want to intend to work on. Like if I intend to work on only a few tables, then I should select those few tables, download them, work on them, and come back and upload. Because remember, when we upload, if I have selected a package with every single table, but I intend to work only on a couple of tables, then when I come back and upload this information, the rest of the tables might be blank or have old information. And when we come back and upload that information, it will replace any existing information within these tables. So this is a good way to selectively choose the tables that we want to work on. Another one is, as Sawyer mentioned, I have an opportunity to select patient by zip code with prior year's zip code when I select a table patient by zip code. What I didn't show you in my system is that I have a single zip code that's included and I have saved it. But if I don't want to manually include all the zip codes that I have already used from prior years, I can then come in, I can download an Excel file, I can include all the prior year zip codes. And what it will give me at the other end is it will append all the last year's zip code within that Excel file. I can then go in, add all my data, and come back and plug it into the system. So that way, I don't have to manually enter every single zip code that I used last year, which I may be using this year too. Another thing that I wanted to talk about is collaborative reporting. Let me unselect all these. So we can leverage the system and allow multiple members of our group to work simultaneously for efficiency. For example, if we have members that are really good at, let's say, they specialize in clinical data, we can individually or specifically select just table 6B and table 7 and download just these two tables as a package. They can work on this offline, individually, come back and plug in the data, come back and upload this data. So they will be uploading only 6B and table 7, right? Only those two sets of data will be included. Now, simultaneously, I might have folks who specialize in, let's say, financial information, and I can download 9D and 9E tables separately. They can work on this simultaneously and come back and upload these two tables separately. And that way we will not be clashing and we will not override each other's information. And it's a great way to find some efficiencies, especially with with tight deadlines. Okay, for our example, let's go ahead with including every single table. I'm also going to include the prior zip code so I can show you how it will include all the prior years in the Excel file. Once I've made my selections, I'm going back to this download template and I'm selecting download button. I have some disclaimers. I'm going to read through them and click on OK. It will be downloading the file at my end, and I'm waiting for that. Here we go. And I think this is the one. Right. Let me open this file. Let me pull this up. This is the Excel file that was downloaded. I'm going to select enable editing so I can work on this file. So this is opening on the first page. This is the README page. Please read through instructions as they are very helpful. This also includes some support contact information so that we can reach out if we need help or if we have questions related to this file. I'm going to the bottom of the page and you can see that we have different tabs individually for each and every table and each and every form. And as I'm here, we also see that all the funding streams, again, this is another tool different from compare version, and that update, that overarching funding stream update has been implemented in each of these tools. So each of these tabs have also been updated with the same information. Let me take you to patient by zip code to show you that all the funding stream, all the last year's patient zip codes have been included. Sorry, my mouse is a little slow here. Let me zoom in just a little bit. So you'll see that this first line includes that one zip code that I already had in the system, and I had some information related to that. And then we have included all of these zip codes from last year. So these have been appended to this Excel sheet. And now what I can do is I can disconnect from the internet. I can completely work offline on this, include all of my data, and then go back and upload this information. So what will happen is all of these zip codes will get uploaded. So I don't have to manually include them one at a time within my system. Okay, from here, I'm going to table 3B so we can look at the general layout of the file. And in general, again, if you worked with this before, the general format of the file remains the same from previous years. The first row, and I'm coming to this, for most of the tables, the first row mentions the kind of data that we are expecting to fill out in all of these cells. Very similar to previous year, again, the data entry cells are outlined. You can see these outlines. And let me add some data in here. If I add any data outside these outline cells, it's not going to get included, or it's not going to get plugged into the EHPs when we upload the file back. It'll just be ignored. So be sure to include data in the correct cells and only in the outline cells, because that's the data that's going to be absorbed back into the EHPs. Let me take you, okay, we are on table 3B. So very similar to the editable forms, remember, we have removed the entire SOGI section from here. So we are no more reporting on that data set. And so those cells have been completely removed. Let me take you to table 6A so I can show you the new lines. Table 6A, the general feel remains the same. The general outline of this file remains the same. And if you see, we have these new lines and data points that are included. And now there are cells related to those data points that are included in this Excel sheet. Sorry, this is the 26F brand new line. And so now I can include the new data within these new outline cells and then go back and plug it into the EHPs. This is just to give you an example. Let's go back to table 3B so that I can make some updates, save it at our end. So here, let's add some bad quality data. Now this is all going, anytime I have a negative number, it's going to be critical. It's going to throw a critical error when we upload this file. So let's add some critical errors here. I'm going to go to one of these funding stream tabs. There's the HP funding stream, and I'm going to include data that may not be good quality data. And we'll see that these will throw errors on the main universal tab and the funding stream tab. Okay. Once I've made all of my changes, I've included the data that I need to, I can go in and save this file at my end. I'm just saving it as test. So we can recognize this file, and I'm saving it in my downloads. And at this point, we can close this file, but remember, that information that we may have entered, it's all still in my local. I'll need to bring it back into the system, into the EHPs. So for that, I'm now back into the system, log back into the system. I'm going to the left menu and I'm going to the upload file link, clicking on that, and it's taking me to the upload file page. And I am, again, the general information of the header section, resource section, instructions, and I'm coming to this upload file section. I'm going to choose the file. And this is our file. We just modified this at 218. I'm going to choose this test file, selecting open. And I also need to select this process file. There is a warning, and this warning is to make sure that we understand that by uploading the file, this latest file, including any blank data, blank cells, that it will replace any data that's already existing in the system. So that's the warning. But I am sure, so I'm going to confirm. Now, there is a reason that that button was not just upload file, and it was called, I also needed to select that process file button, because this is not just a simple like upload where it's like data being consumed and plugged into the system. What's happening at the back end here is that it's actually processing that data at the back end against all of those edits we had mentioned within our system. So it's going through that process, and that's the reason it takes a little while. It's not just a simple upload. And also, as we are on this page before it changes, notice that I have initially completed all of my tables, and now we are trying to re-upload a new set of data for every single table. I'll come back and show you that the complete status will be updated here. Okay, so here we have the success message, and remember we have uploaded every single file. So we have all the tables, every single table. So we have all the tables successfully uploaded. If we had selected just few tables, it will clearly mention the names of the tables. Once we see the success message, what has happened, and I'll show you the impact. If we look at the left menu, all the tables that were in complete status now have gone back to in progress status, because all of this new data has been plugged in. And now as a user, I need to go into each and every table, make sure that my new data is correct, it's good quality, and then save that data and then complete the table. What we will see, and I'll go back into one of the tables, is that any edits that have fired would be included in that table, and we'll have to clear them. Now, to get a list of all of those errors, I'm still on the same upload file page. At the bottom of the page, we have this error summary, and this is the file in which you see that I have 20 failed edits that have failed. And this is the file that I can refer to if I want to go in to see which table has what errors. It'll show me a mapping. But for our needs, we'll just go back into the table itself. If you remember, we had made adjustments to table 3B. So I'm going to table 3B, and we had some critical errors. Look at this. I had some negative numbers in here. It's throwing an error. It's clearly calling out that I have some critical errors. And then I have some errors that I can, I will need to clear before I submit, before I get my table to complete status. So I can go in, I can clean up this data, and you see one of those errors have gone away. Same way I can clean up this data. I can go back to the funding stream tab, HP. And remember, I had included some data. I can remove, I can update. Sorry. So I can update this information and those edits will go away. So these edits will fire as and when it sees bad data. And that way we can sanitize our data before we then, I can go back down and I can save this file. Sorry, save this report table, not file. Save this table and see, I have got it back to the complete status. So this way I'll have to complete each and every table before I can then eventually submit. So this is the way to use the offline tools and then bring data back into the system. Okay, with that, I will give it back to Sawyer.
Beautiful. Thank you, Reshmi. And just as a reminder, if you do have any questions, keep throwing them in the Q&A pod and we will continue to answer them for you. Now, let's go ahead and take a look at the offline HTML feature. As with the offline Excel feature, the offline HTML is an optional feature within UDS. Just like with the offline Excel feature, when you download the HTML file, you can either download the entire report or only specific tables that you wish to work on. Note, and this is an important note, that the file will only open in Chrome. Once you open the file, it will look just like the UDS report in the EHBs with a banner at the top reminding you that you are in an offline HTML environment. Most important, once you've entered all the data, you will need to export the data to an offline Excel file and then follow the steps we just talked about to upload the file to the EHBs. The steps for accessing the offline HTML form are the same for those for accessing the offline Excel file. The only difference is when you select the offline HTML, you do not have the same choice to select a blank version or a version with data included. To open the file, you will need to extract the files, then enter the tracking number when asked for a password. You will then be able to click on UDS submission to open the offline HTML file. And again, Reshmi will walk you through all this in just a moment so you can take a look at what this looks like in real time. As we talked about with the PRE and live EHB systems, when you are in the offline HTML version, you will see a banner at the top of the page as a reminder of which environment you are in as you're entering your data. As you are working on the data entry, you'll notice the form looks exactly like the live system, which is why you'll see those banners at the top of the pages. And if you're in the HTML form, remember you'll need to upload the data back into the system so it can be processed and you can submit the report. Just like in the live system, as you enter data in the offline HTML form, you can use the left menu to navigate through the forms. The validation checks that happen in the live system will also happen here, which is helpful to make sure that your data is correct. If you or a teammate had entered information in the offline Excel file and want to incorporate that data in the HTML version, you can select Import File while in the offline HTML environment. Then select the Excel file to import. After importing the Excel file, the information from that Excel file will overwrite the existing data in the offline HTML forms. And this is helpful to get the validation checks on the data from the Excel file before processing it in the live system. Once you've completed the data entry, export the UDS forms into an offline Excel file. Then upload your Excel file back into the HBs. And remember, this is required to get the data from the HTML file into the system. And here are a couple helpful tips on the offline HTML feature for you. You can download the offline HTML file as many times as you need. And you can export the data to Excel as many times as you need as well. And as mentioned earlier, be sure you are using Chrome to open the file, as it will not work in any other browsers. Once again, I'll hand it back over to Reshmi for our fourth demo to cover the offline HTML form.
Thank you, Sawyer. Let's get back into our system. So for accessing the offline HTML, again, we'll be accessing the offline tools via the download file because we'll need to download this offline HTML file. But before we get there, we need to go to status overview. Again, you can grab this from any page, but it's just easier to grab it from here because I can select it and copy it. So I'm going to the right below the notes, and before your health center's name, there is a tracking number that starts with your activity code. Over here, for example, it starts with HAD, and I'm grabbing this entire number. I'm copying this. And then once I have this copied, I'm now going to the download file. And I'm accessing this through the left menu. Again, same page as we came in and downloaded the offline Excel. So this time in our template, we will switch to offline HTML. And we do have options to select the tables that we want to work on, but we don't have an option of the data, whether we want blank or with data. This is just going to give us any table that we select with the data that's already included in the system. And for now, for our demo, I'm going to select all the tables. I'm going back to this download template and selecting the download button. We have instructions. I'll read through that and select OK. Now this will download a package for us. Let me pull up my folders so we can okay, so you see that, and this is within my folders, we see that we have this zipped package that has been downloaded. I'm going to right click and extract all the files. I'm going to extract all and selecting it. This is the extract compress zipped folder message, and I'm going to select extract button, and it'll ask me for a password, and I'm going to paste that tracking number in here and select OK. And what this will do is it'll give me a whole bunch of files. So you'll see that there are multiple folders, and then there is a HTML file. Please don't tamper with any of these folders. Don't delete them. Don't, if you go in and adjust anything, this file will not work. So don't tamper with them. Just come to the last file. This is the UDS submissions, and I'm going to right click, and I'm going to open this with the Google Chrome. As Sawyer mentioned, this will work the best only with Google Chrome. So I will need to utilize Google Chrome and open this file. Okay, let me pull all this back. Okay, these are my folders. So now this is the offline HTML file right on top. And again, at this point, I can completely log off, or I can get off the internet. I can work on this completely offline. And you see the look and feel of this file. It looks very similar to the EHPs, but the way to identify this would be through this top banner. Right on top, it will mention that we are in the offline HTML tool, and we can enter and validate UDS data and prepare for reporting. And we don't need internet connection in here. And we'll need to upload this file back into the EHPs for this information to be logged back in. So that's a good way to identify what environment we are working on. The general look and feel again, is very similar to the EHBs. The navigation to table and forms is very similar to how we were looking at within the EHBs. And also remember, most of our tables were in progress state, and we just completed table 3B. So that's the input that we have downloaded it with. So we have all of that information included in here. I'm going to table 4 just so I can give you a little bit of input on the data entry. Let me include again some incorrect data, and you'll see that very similar to the EHBs, we have edits in here so you can sanitize your data before you even bring it into EHBs. And all of this can be done completely offline. And I can go back, I can correct my data, right? And some of those edits will go away. Let me go to 3B because I'm just familiar with that data. Let me do this. So if I add incorrect data, you see that a whole bunch of edits will fire, and I can go back and correct my data and they will go away. So we do have the ability to fire edits in here, though it's completely offline. The only big difference between the offline and the online is obviously that not every single edit can be fired in here, which means that we can't go into the DAR. You see that we don't have the DAR page in here. We don't have the review in here. So this file is completely utilized only for including data and to an extent sanitizing this data. But to run the DAR, we'll have to plug this information back into the EHBs because DAR will require us to validate data against some threshold values, prior year values, and things like that. So DAR cannot be run on the offline HTML tool. Now, once I've entered in my data, and remember, it's very similar. The save and continue button is the same. We can add comments. So all of that is very, very similar in the offline offline HTML tool. Once I've included all the information that I need to, the way to get it back into the EHBs, and remember, this is something that's local in my folders. I need to go back to the left menu and export this file. So we are exporting all of this data. It will need to be exported in the Excel format, and I can select the export file. This will be exported. Let me pull up the Excel file that will be exported in. So the file will look something like this. Sorry, my mouse is a little funny today. But this is how the file will be exported in this Excel format. And from here, it's going to be the exact same process to upload this Excel file within, and I'm going back to my EHB system. I've switched screens. You see I'm in the EHB's system, not the offline version. And I will need to come back, upload this file the same way I did with the Excel, the offline Excel, and then plug all that information back into the system. So that's the way we use the offline HTML file. Again, a very useful tool. We get a lot of flexibility with this. And with that, I'll give it back to Sawyer.
Beautiful. Thank you very much. And just as another reminder, if you do have any questions, please go ahead and put them in our Q&A pod and we will get those answered for you. All right, so this next section, we're going to take a look at a few different things. First, we're going to look at how to delete all the data on the report if you need to start from scratch, and then the steps to finalize and submit your report. If you want to permanently remove all the data in your report or from just specific tables, you can easily do so with the clear data option. Please take note that the data entered on the report is not backed up in the system, so you cannot recover the data once deleted. So you need to be very careful when using this feature. To start, click Clear Data from the left menu. Select the tables you want to delete information from, and once you click Clear Data, you will see a confirmation message reminding you that the information will be deleted in the system. Click the Confirm button to permanently erase the data from those selected tables. This can be very helpful to remove test information entered, but like I said, please be careful because you do not want to lose any of your real data that you entered. Before you can submit your report, you must run the Data Audit Report, or the DAR. Running this report verifies there is consistency with the data across the tables. For example, if there are related data fields and the information entered does not match, you will then receive an error where you can go and change the data or enter a note explaining that discrepancy. First, select Data Audit Report from the bottom of the left menu. Then click Run Data Audit Report on the right side of the page. As a note, when you are resolving cross-table validations and return to the DAR, you must rerun the DAR to resolve failed cross-table validations within the actual DAR. You will then see the results on the page showing any errors with the description of why that item was flagged as an error. Using the Action drop-down menu on the right side of your screen, select Fix to fix that error, which will take you to the page of that report. Or you can click Add or Edit Explanation to enter a description to further explain the data. Make sure that you address each item listed, as you are not able to submit the report when there are any DAR errors listed. After running the DAR and fixing any errors or adding comments, you can then click Continue to Next Page or select Review from the left menu to review the tables. On the review page, you can click View to open each table and complete your review. Once you are ready to submit your report, click Submit from the left menu, or on the right side of the status overview page, select Submit Performance Report. On the Submit page, type I agree in the text box to certify that you have read and understand the summary. Then electronically sign the UDS report. Click Submit to submit your report to BIPIC. And then that's it. Your report is now submitted. Once the report is submitted, you can view the performance report from the Submissions All page in your tasks. From this page, you can download the Excel file using the right side of the screen, view data for each table, or print and save a copy of the performance report. On the bottom right of the screen, click Continue to Next to view the submitted confirmation page. And Reshmi will walk you through this in just a moment so you can see the process, as well as what the downloaded report looks like in that Excel format. On the Submit Confirmation page, you can find the tracking number for your submission in the middle of the page under the success message. And with that, I'll hand it over one last time to Reshmi for our final demo to cover the other features, the data audit report, review, submission, and download.
Thank you, Sawyer. And let's get back into our system. Okay, so let's start with clear data. And for clearing data, I'm coming to the left menu on the top a portion and selecting the clear data link. It'll take us to clear data page. And again, we have the header, we have the resources, and then we have some cautionary instructions. Similarly, on the same vein, we'll see select tables not pre-selected by default. And both these things are because we don't want you to lose your data by mistake. It's a great tool to find some efficiencies and save time and go clear any data that you may have, which is not good data in any of the tables, instead of manually going in and clearing them up. This is a great way to go in and clear it up with one click. But remember that once we clear any data, all the data for that table will be lost permanently. We will not be able to retrieve it from any kind of tool. So that's the cautionary guidance in here. So we need to select the tables that we want to clear data very intentionally. Let's go in and clear table 4 data. I do have some data in there. So obviously, if I want to start completely fresh, I can just select all the tables, but please use caution. For now, I'm going to just select table 4 and then select clear data button. This will again warn us and show us the table that we have selected for clearing the data, so that it's another cautionary step, so that we don't lose all the data by mistake. And so once I confirm, once I'm sure, I can select confirm. And we'll wait for that success message. And so it'll clearly tell us that the data cleared successfully for table 4 or any tables that I may have selected. And if I go to table 4, we will see that all of that data would be gone. If you see, the entire table is completely free of data. Okay, so that's clear data functionality. Again, great feature. Please use it with caution. All right. As we move down, I actually want to show you the data audit report too. But here you can go down once you have everything completed. We can include a report level comment that will be going out to BIPIC, and if we want to convey something to the reviewers. At this stage, let me switch users because I do have another user where I have completed all the tables. Give me a minute. I'm switching users. Again, I'm logging in very similar to what we did previously as we were logging in. Please bear with me as we log into the system with another user, selecting my report. And again, for everybody who's watching, I have switched users, so it's not the same user. I have it I'm opening this in a different browser. Okay, I'm now, okay, I don't have it here. All right. For now, just so you can see the screen and understand visually how it will look, I will run the data audit report. I will then, and when I get into the data audit report, when I say run the data audit report, I will be clicking this run data audit report button to refresh my page. And here I don't want to do it because it's going to take time. Remember, these are all edits that are, again, they're validating through threshold values and last year's or previous year values. So these are the kind of edits that may fire, and we'll need to go in and either fix the data in the table or add an explanation. And it will depend, these options will be provided depending on the kind of edit that has been fired. Some of the edits will not have an option to add an explanation. I may need to go in and fix the data, but there may be other edits where I can either explain the discrepancy or I can go in and change that data. Once I've done that, and again, let me pull this down. If I choose to change the data in the table, if I click on this, it will click on the table name. It'll take me to that table, and then I can work through my data. And then I'll have to come back in and run this data audit report again to refresh the edits. But once I've cleared all of them and I don't have any edits in pending status, here you see I've explained all the edits, and I have all the tables in the complete status. I can then go to review. Sorry, it's changed on me right now because I think we are, the user has been flipped slightly. So, but we'll work with this. So I'm going into the review section, the review page, and I can go in and review my data through this view link. Waiting for it to load. Apologies, please bear with me as it loads. So this is a read-only page, which means I cannot go and make any adjustments, but I can thoroughly review the data that I have included. And if there is an adjustment to be made, I need to go back into the system. I need to go back into the EHPs and then make that adjustment. So once I'm through with reviewing everything, everything looks good, I can then go to the submit page. And obviously I don't have the submit button here because I don't have all my tables in complete status. Let me pull up a screenshot so I can show you. Let me show you. And again, I'm switching screens on you. This is just a screenshot, but I want to show you a visual at least. Once I have all my tables in complete, I have the dot and complete, I can then go to the submit page. I can review the HRSA confidential data pre-disclosure summary. I can type, I agree. Let me take you here. I can type, I agree for both these sections, also for the UDS certification section. And once I type I agree, I can then select the submit button here. And once I select the submit button, my report is submitted to HRSA. I will get this sort of confirmation success message. And just like Sawyer mentioned, I can utilize my tracking number to track my report. Let's go back to the system once again so I can show you how you can get your submitted how you can get your submitted data from within the system. I'm going to grants, going to work on performance report. This will navigate us to, this submission all page. And obviously I have not submitted my 2025 report, but if we go to any previous years, and it will do the same, the functionality is the same. So if I want my submitted data, I can select performance report from my options column, and it will navigate me to this review and report list page. I do have access to my data file in the XML format that I can download. I can also download my data in the Excel format, and I can select download from the actions. And this would include all the data that I may have submitted to HRSA. Let me just take you here. So it will include all the data I may have submitted with my comments and all. So that's the way to get to submitted data. I hope you have a really good understanding of the system. And with that, I will give it back to Sawyer one last time.
Beautiful. Thank you, Rashmi. For the interest of time, Rashmi, we're going to skip the next two slides, which are our poll question, and skip right to the resources available for everybody.
Sorry. Yeah, here we go.
All right, thank you very much. So thank you so much for your time today. We have several resources available to help you with any questions you have while working on the report. There are user guides and quick reference guides that you can access through the resources tab, as well as wiki help pages that you can find in the EHP's help section. And of course, you can always reach out to the HRSA help desk for assistance. We will also upload the slides in the chat box again, just in case you may have missed them at the beginning, as well as send out all the information in about a week or two once it's all finalized. If you have any last minute questions, please go ahead and put them in the Q&A pod and we'll do our best to get to them. But if not, we will address them later for you. And I just want to say thank you so much for joining this afternoon. We have listed the different help resources for each access, the UDS help desk, the EHB's customer support for EHB's questions, and the Health Center program support team with the BIPIC contact form. And I will turn it back over to Alicia if she has any closing comments. But if not, I hope everyone has a fantastic day and thank you for joining us.